Roy Adaptation Model in the nursing practice setting. The middle range theory is a development in a theoretical framework that combines theory with empirical and practical research. The theory starts with observable phenomena, understands them, and then compiles them into a single report that is statistically supported. Researchers interested in explaining the components of a concept rather than the idea itself generate this theory. This theory serves as an intermediary justification for all the empirical uniformities of social changes, behavior, and structure. Research and practice are connected using middle-range theory. An inductive or deductive technique may be used to create the hypothesis. In nursing, middle-range theory is used to explain or anticipate aspects of healthcare delivery. The Roy Adaptation Model, RAM, is chosen to analyze and evaluate middle-range theory. Developed by Sister Callista Roy in the 1970s, it is a nursing theory that focuses on the individual's adaptation to various environmental stimuli. The theory is based on the idea that individuals have a unique way of adapting to their environment and that nurses can play a crucial role in facilitating this adaptation process. The major concepts of the Roy Adaptation Model include the individual, the environment, and the nursing process. The individual is seen as a holistic being with physical, psychological, social, and spiritual components. The environment is the context in which the individual lives and interacts with others and can be either adaptive or maladaptive. The nursing process is how the nurse facilitates the individual's adaptation to their environment. It is important to note that the nursing process is not only limited to the interactions between the patient and the nurse but also includes the involvement of other healthcare professionals and the patient's family and friends, who also play a crucial role in the patient's adaptation to the environment. Consequently, the philosophical basis of the model is that health is a dynamic state rather than a static one. According to the theory, health is not simply the absence of disease but the ability to adapt to changing environmental stimuli. This worldview is consistent with the holistic approach to nursing, which recognizes that individuals are not just biological beings but also have social and spiritual dimensions. Further, the model's structural aspect includes 4 adaptation modes: physiological, self-concept, role function, and interdependence. Physiological adaptation refers to the body's ability to maintain homeostasis, which is crucial for survival. Self-concept adaptation refers to the individual's perception of themselves and how they view their abilities and self-worth. Role function adaptation refers to the individual's ability to perform their societal roles and how they understand their responsibilities and contributions. Interdependence adaptation refers to the individual's ability to interact with others and how they form and maintain relationships with others. All 4 modes of adaptation are important for a person's overall well-being and functioning. An area of practice where the RAM could be particularly applicable is in caring for patients with chronic conditions, such as diabetes or heart failure. These patients often have to adapt to a new way of life, with changes in diet, exercise, and medication regimen. The Roy Adaptation Model can provide valuable insights into how patients adjust to these changes, including how they cope with their condition's physical and emotional challenges. Additionally, it can help to answer questions about how nurses can facilitate this process, such as identifying barriers to adaptation and developing interventions that support patients in their adaptation journey. The RAM can also help identify resources available to support patients, such as support groups or community resources. Furthermore, it can be used to evaluate the effectiveness of interventions over time, which can help to inform future care planning. In this way, the RAM can be a powerful tool for promoting patient-centered care in chronic conditions. The Roy Adaptation Model is an appropriate approach for the practice setting as it is holistic and patient-centered. It helps to consider the individual's overall well-being in their physical, psychological, and social needs. However, implementing it in practice can be challenging as it requires a lot of time and resources to assess the individual's adaptation and to implement the nursing process. Additionally, the model needs to provide specific guidelines for interventions, which can make it difficult to support the patient's adaptation process best. This can be especially challenging in fast-paced clinical settings with limited time and resources. Furthermore, nurses may require additional education and training to use the RAM in practice effectively. Despite these challenges, it can provide valuable insights into the patient's overall well-being and can help to guide interventions that support their adaptation process. According to the literature review, the Roy Adaptation Model has been widely used in clinical practice. It has been applied to various patient populations, such as those with cancer, HIV, and chronic conditions. The study by Wang et al. Suggests that the RAM can be useful in improving patient outcomes, such as reducing hospital readmissions and improving quality of life. Additionally, the literature also shows that it has been used in nursing education and nursing research as well. However, there are also limitations, such as difficulty in operationalizing the concepts of the theory, which makes it challenging to measure the effectiveness of the RAM. Incorporating it into nursing education and making it a mandatory part of the nursing curriculum will help to make the RAM more usable, as future nurses will be aware of the model and can apply it in practice. In conclusion, the Roy Adaptation Model is a middle-range theory that provides a holistic and patient-centered approach to nursing practice. It is appropriate for the practice setting and can be applied to patients with chronic conditions. However, it can be difficult to use in practice due to the time and resources required and the need for specific intervention guidelines. Further research is needed to operationalize the RAM concepts and evaluate their effectiveness in practice.